In the intensive care unit at this East Toronto hospital, frontline healthcare workers are caring for the most critical COVID-19 patients.
Right now, stress is all the way over.
It's busy, it's somber, and as patients struggle to survive, the medical team struggles to cope.
Resilience is a challenge, burnout is real.
Then, amid a flurry of physicians and nurses, comes Philippa Dawood.
I'm not a therapist or a counselor. People will pull me into closets, into corners.
She's the wellness coordinator.
Are you ready? Are you ready? We're going to get going. Ruby!
And when she arrives, the mood here shifts. Dancing, in stark contrast to the sadness, pain, and suffering that surrounds them.
There's a lot of guilt. I hear a lot of guilt in people saying, I shouldn't feel this way because I'm a certain age or I'm a mother.
Like some of the literature would suggest that about 75 to 80% of physicians in North America are experiencing burnout.
In understanding the mental health impact of the COVID pandemic on healthcare workers, studies point to past infectious disease outbreaks like SARS and the long-lasting effects. What once got them through the day, says patient coordinator Ann Lee, is no longer possible.
We are not hugging each other anymore, and we always have to have our masks. And so, but you know what? We are trying our very best to just support each other verbally.
The nationwide movement to thank those on the front lines a year into the pandemic has faded. This psychiatrist says it may be time to revive it.
Feeling appreciated by your community really does make a difference in emboldening your own personal resilience.
Social worker Haley Harlock, whose husband works as a surgeon, started an online support group for physician families.
If your spouse is telling you I'm fine, you might not know what the next step may be.
Harlock points to research suggesting support exists for doctors, but many aren't accessing it. She'd like it to start at home.
If we included physician families as a partner and as part of the team, then there's a lot of room to educate families and what to look at.
Back in the ICU, the team is moving and grooving.
When you leave, they're laughing and they're smiling. And that, I believe, has enabled a greater conversation. Staff are not alone, and it's okay to not be okay.
A brief reprieve from the reality of caring for patients with COVID-19. Caryn Lieberman, Global News.